for CA209, it was a single center trial of 47 patients. And so this is a significantly smaller trial than the Keynote B61 or SUNNIFORECAST, where a lot of providers have a lot of experience using nivolumab, cabozantinib in the clear cell space. For many, it might be their first choice, and so it's very familiar. But in terms of the strength of the evidence, it's a small study, and that's not a criticism. It's a phase two trial, and it's a very impressive study. But in terms of how confident can we be in the results when it's a non-comparative trial and it has relatively small numbers, especially of some of the different subtypes, such as chromophobe. There were 7 patients that were initially included and then not subsequently reported upon in future updates. So I think it remains an option, but I think if we're going by kind of the strength of evidence, I think Keynote B61 probably has it beat as far as doing cross-trial comparisons, looking at objective response rates. I think that you get into dangerous territory, as myself and many others have noted, because of differences in the baseline patient population. And so the truth is we just don't know which regimen it might be the best. But I think that the cabozantinib nivolumab regimen is certainly an option. For me personally, coming into ESMO, the Keynote B61 pembrolizumab and lenvatinib regimen was what I was choosing for the majority of patients with non-clear cell. And that was because it was a larger trial, 158 patients, also not a comparative trial in terms of it's a single arm trial, but showed very promising results in terms of objective response rates across different histologies. And in this case, the different histologies had, more like 30 for chromophobe, 29 for chromophobe, 20 for unclassified, in the 90s for papillary. So a little bit larger numbers, the confidence intervals being a little bit smaller then. And also seeing, pretty impressive both progression-free survival in the, I think 17.9 month range, and not having long enough follow-up really to get a median overall survival, but pretty strong numbers from Keynote B61. And so, that was sort of my go-to regimen coming into ESMO for most patients.